we'll scan for the greater occipital nerve. So to do that, we usually place the patient either sitting or in the prone position with their neck flexed. So to start, I like to start over top of the greater occipital prominence and find that. And you'll see that here at the top of the screen. Next, I'll scan downwards, okay, and we'll be looking for the spinous process of C2, which is very prominent, and a bifid spinous process. So it often is quite characteristic, and I think we're seeing hints of it there. Once we find that, which is down here, we'll scan slightly laterally and rotate the lateral aspect of the probe, and then we'll scan a little bit to try to see if we can't bring out the greater occipital nerve. So what we're seeing here is the greater occipital nerve here, and it's sandwiched in between the semispinalis capitis muscle, which I've indicated with the arrow there, and the obliquus capitis inferior muscle, which I've also heard called the occiput capitis inferior muscle. So usually to do this nerve block, we come in from lateral to medial and target the fascial plane in between the two muscles next to the greater occipital nerve. If you're unsure of whether or not that's the greater occipital nerve, you can actually stimulate it with nerve stim, and they'll get a paresthesia in the back of their head, and you'll often also get twitches of both the muscles in the back of the head as well, and so you'll know that that's actually the greater occipital nerve. The other important pearls with this block are to use a lot of ultrasound gel and to increase the gain as much as you can to do this, and that's because of the acoustic impedance of most people's hair.